Hello, and thank you for joining our Sunday self-care. It's a 7 p.m. evening time slot today, and this is the first day I started this. We did a session this morning, which was all about waking up and tuning into your body and giving your body some self-care, self-treatment before you even get out of bed. Or if you get out of bed, but then maybe use the restroom and need to come and can come back and do that. But tonight it's a little bit different. I wanted to share more about what I often do in the evening time. I typically don't do these things that I'm going to add in tonight's practice in the morning, just because my lifestyle, I prefer to get up and I do my little bit in bed, and then I like to get outside if I can, or do my exercise and be a little more active. And then in the evening, especially on days that I'm working, I've used my body quite a bit in a static position. A lot of times I'm treating patients, so I have a lot of tension going on throughout my body, and I drive a lot, so there's a lot of that sitting time, and I really need a different type of self-treatment in the evening. So that's what I'm going to share with you tonight. I'm going to ask you to have your sound off, unless if you really have a question and you want to interject, please feel free to do that. But at the end, I'll definitely take some time for questions, and want to remind you that don't do anything that feels uncomfortable to you. Definitely, everything I'm doing here tonight is not perfect for everybody, right? So if you're doing the calm technique, which I'm going to be explaining a lot about, then you will not be forcing your body to do something that's uncomfortable. Please don't ever think, oh, she's doing that, so it must be okay. All right. You know what's going on in your body way more than I do. And a lot of this is about learning how to even know what that is, because we are not taught how to listen to our bodies. At a very young age, we are put into a situation in a school setting, usually, where we are expected to be in a certain place and we can't take a break until a certain time, or, we're already learning at a very sometimes even a toddler stage, to not listen to our body's signals, right? So what we're doing here is trying to relearn that, trying to connect to our bodies and be more aware of the whispers that the fascial system is giving us, instead of waiting until it's screaming at us. So these practices that I'm doing tonight are things that I do regularly. I like to think of it as I have a minimum of self-treatment, and there are certain practices that I know just from years of doing this, that if I don't do this X number of times per week, then I'm going to probably have some trouble, and my body's going to be talking to me a little bit louder than a whisper. And recently, that's kind of what's been happening with me. I've been working a lot. I've been driving a lot. I've had a lot going on. And although I have truly been self-treating every single day, I don't miss a day, I'm not doing as much as I would like to do, or that my body is really asking for. And I know from experience that I can go a while doing that, but eventually it's going to bite me, right? And it really kind of is now. I mean, in the last month or so, I've had some symptoms, and I'll just share with you. My right hand, for example, where I'm very dominant, I have had injury in this hand in the past, and lots of trouble with, working long hours and not really knowing how to care for it. Several years ago, I had a very serious carpal tunnel syndrome. It was because of the work that I was doing. And when I start to get tightness in my forearm, in my palm, in my hand, and sometimes up into my neck, I know that I need more treatment, more self-treatment, right? And when I don't get that, it starts to catch up with me. And it's kind of caught up with me the last couple of weeks, especially. I have a numbness going on in my hand that's kind of constant. And after I'm working, or while I'm working, I might get some really significant numbness in my hand. So that doesn't worry me at all. Just to let you know, I've been here multiple times, and I've treated it sometimes just by myself, not even getting hands-on treatment by a therapist, and I'm able to resolve it. So this is about empowering you to learn things, and to know that our body will adapt when we start listening and learn techniques to how to treat it and how to treat these whispers and these requests that the body is giving us. So right away, I know just from the last couple of weeks that I need to manage some of this. Okay. The other thing that happened a couple of days ago when I was running, I was feeling some tightness in my knee and down my right leg. It wasn't pain. I mean, some people may have called it pain, but for me, it was like, ooh, there's that familiar tightness sensation. And the old me, the runner me from 30 years ago would be like, okay, I can just run this out, and in a few miles, it's going to feel different and it's going to be okay. Well, what would happen is, well, a couple things. My body would adapt, and maybe I wasn't feeling that exact thing, but I might be feeling something else. And then the other thing that might happen is I would just tune it out. So we get really good at ignoring, especially, look at the ultra athletes and long runners and that kind of thing. They really learn how to turn off the signals, and the body, the mind can do that. It can completely ignore and separate and become disconnected so that they can get the job done. And I know not to do that now. So when I felt that tightness coming on, I did run a little bit longer, not much, and I realized, okay, I need to walk the rest of the way. And I know that tomorrow I'm going to take extra time to get these techniques done. Actually, later that day, I was able to do some techniques and I resolved that discomfort in my knee. This morning, after my morning routine that we recorded, I spent more time than I normally would have because I did the session here. And my whole right leg felt so great. I ended up walking and doing some running for 5 miles this morning, and it felt amazing. I didn't have one little glitch in my whole body, actually. So that sensation that I was feeling a day ago with a very short run was completely resolved from something that I did myself and that you can learn how to do too. Okay, so enough rambling. I'm going to start by putting my awesome toes on. And if you don't know what awesome toes are, I can actually put the link for them. We carry them at the studio. I just buy them from Amazon. They're from a company called Yoga Body, and they're really, really nice silicone. I've been using these for about 10 years. I've had probably several pairs of them because they do kind of get grungy after a while, but because I wear them all over. I'll put them on in the evening. I'll walk around the house. I wear them when I do self-treatment. But they're really, really nice. They help to spread apart the toes. They're just like taking up the slack between the foot, between the bones there, and my feet actually crave them because they just you don't have we have to wear shoes all the time, right? And just to get these feet open and relax, we're getting the fluid to flow better. There's less compression between the bones and just really, really nice feel. So it's nice to use these when I'm doing self-treatment. And then I also put some peace and calming essential oil on and took some deep breaths of it a little bit ago. Really, really nice to add essential oils. Essential oils are something that I use every single day, like multiple times a day. I've just had some really incredible benefits from that. I probably don't talk about them enough, but just reminding you about the CALM technique. So CALM, C stands for connect, A is assess, and then listen and move. So I'll be incorporating those in what I'm talking about this evening, and I am eager to get into my strap here. So if you have a yoga strap, I recommend having this. We're going to be using this in a little bit. If you don't have a yoga strap, anything that's long and is not stretchy, so a TheraBand or an exercise tubing like that doesn't work. But heck, I've even had people use a tie, a man's tie, or the belt to a robe or something like that. If or a rope, even a dog leash can work. But we're going to be using this. And then I have a foam roller here. But if you don't have, I'm actually going to use my half foam roller. If you don't have a foam roller, I love to use my melt rollers. There's also, you could use a pool noodle, or you could take a towel or a blanket and roll that up and make it like a tube to go down your spine. The other thing you could use is a pillow. So I have a big fluffy pillow here that I actually do not use this. It's way too thick to use under my head, but I will use it for other parts of my body as a prop. So Let's just start by lying down on our back. And we need to get comfortable with assessing and knowing what the things that we're doing, how does our body respond to it? And if we don't pay attention at the beginning, we have nothing to compare it to, right? So when you just lie down here on your back, and you can be on your bed, but if you're on the floor, you'll feel this more because of the firmness of the floor. So as we connect to our body, I like to use the saying, fully arrive. Just fully arrive with your awareness in your body and feel your body lying on the surface. Now, if you have any discomfort lying completely flat, you don't need to stay here long, or you can get something under your knees, but we really want to feel, because everyone should be able to lie flat. If you can't, because of discomfort, there's a reason. Something is tight, and a lot of times people will get low back discomfort lying here. And I can tell you right now, I'm pretty tight right now. Of course, I had that long walk run, and I did some, cleaning up around in the garage today. And right now I feel some compression and very mild, but discomfort in my low back. I have just the sacrum, almost like my tailbone is touching the ground. And then there's a big arch in my low back. And then I don't feel my back touching until I get like right below my shoulder blade. So there's a lot of tension going on in my center of my body, kind of lifting it up off of the floor. And then the back of my head, of course, is resting there. Your neck usually is not on the floor. There should be a space between the floor and the back of your neck. But as I feel my legs now, one leg feels closer to the floor than the other. And notice if you can sense that. You might even notice that it feels like one leg is rolling out more than the other. So for me, my whole left side is down into the floor more. It almost feels like my left foot is rolled out more, and actually it is. You might want to take a look if you can feel that. And then as I tune into my shoulders, if I think about a shoulder being closer to the ceiling and one closer to the floor, I definitely feel, just like my left leg, my left shoulder is closer to the floor. My left shoulder blade is digging in more, and my right shoulder, it feels lifted up off of the floor. And there's almost like there's tightness in the front of my chest and shoulder on the right, which I kind of noticed this morning. Again, that's this whole right side that I know there's something kind of going on there. So just tune into your breath and feel the belly expand as you inhale, nice and long and slow. And now, just like you see, I have cats, right? So the cats, when they wake up, they often do this sort of lengthening into their body. We're going to do some leg lengtheners, and it's sometimes nice to start by bending the knee. Bending one knee, I'm going to bend my left knee, and I'm going to reach my right leg away by pulling my right toes toward me and reach my right heel away from my waist. And I feel that lengthening up into my body. And while I keep that leg lengthened, I'm going to take my right arm along the floor like a snow angel. And think about how you have to push that snow with the upper arm. So we want that upper arm to stay down. It's not a lift. Don't lift your arm up off the ground. It's a sliding out to the side like a snow angel, and go as far as you comfortably can until the arm either wants to come up off the floor, or you can reach all the way overhead and lengthen. So reaching the fingertips away from the waist while the heel reaches away, and feel that whole side lengthen. Notice and remember what it feels like to reach the side. Do you feel it anywhere in your body? Now that low back discomfort I was having, I still can feel it here. It is still pretty much in the center. And then I'm just going to reach it back down again. I'm going to bend my right knee and lengthen the left leg, pull the left toes back toward me and reach the heel away. And left arm, let's snow angel that up. Oh, my toy's in the way here. And then reach and lengthen the fingertips away from the waist and the heel away from the waist on the left side. And how does it feel different over here? And maybe it feels the same, but just notice and compare and breathe. I'm just going to go ahead and straighten out my right leg also and reach and snow angel my right arm up overhead and just do a full body stretch. Noticing what you're feeling. And then we think of this assessment, the C and the A, connect, assess. I think of this as more of a left brain activity, more channel 5, as John Barnes would say. And then as we go into listening, I think of that as more of a channel 3, and not left brain, but more right brain, more feeling into the body. Notice what connections are happening. What else are you feeling? And then M, when we think of M, it's move. And sometimes I joke, move means just maybe get on the floor and just start doing something. Or as we're here lengthening and listening, I'm letting my body move. My legs just kind of want to move back and forth a little bit, almost like that sort of animal cat sensation, or the dog as they're waking up from a nap. Just let yourself reach and lengthen, maybe back and forth. Let your head roll side to side. A few deep breaths. And then let the arms come back down. Just kind of wiggle your body and resting on the floor. Mm. And just with that tiny little bit of movement, see if you can sense a little difference. And I definitely do. My body, my back, my spine is a little more onto the floor. My left leg isn't as much into the floor compared to the right. And just see what you notice. So I am going to take my roller now. So I'm thinking about the tightness in my arm and some of that discomfort that I've been having. I think I'm going to go for my half roller. And when you do the roller or the towel or the blanket, you're going to scoot it all the way down to the tailbone, all the way down. So if I start here, my head's going to be hanging off. So you want to scoot way down and then slowly roll down. Notice how I'm rolling one vertebrae down and then the other all the way down, nice and slow onto the roller. Because if you just lie on here and if you feel like your back is really arched, it's okay to lift into your feet, maybe lift the pelvis up and wiggle around a little bit so you're nice and flat and straight on this roller as much as you can comfortably be, okay? So yes, I feel a space in my low back, that's fine, but you just want to make sure that you're comfortable and not arched excessively. And I'm going to bring my arms out to the side here, so this hand is also kind of out at shoulder level like a T position. And since I have this pillow here, if I had some pressure on my right arm right now, that would feel really good. So I'm going to take this pillow. It's kind of a heavy pillow, like I said, and I'm going to rest this on my arm. And it's just giving me a little bit of pressure, but just that little sensation. Now I'm on a half roller, so there's not a lot of space here. But it's still opening. It's really opening up that chest, and I can really feel that pull. I'm going to settle into this space now, really connecting. My feet are comfortably apart. My knees are bent. It doesn't feel like I'm straining anything to keep my legs here. My head is rested. Now, tune into your head, because if your head is tilted back like this and your chin is up, we don't really like that. Try to lengthen the back of your neck so that that chin comes down and your head is more parallel to the floor. If you can't do that, you might need to put a little something behind your head, like a folded towel or a blanket, something like that. And tune into your breath. See if you can feel your belly rise and fall. And I don't have my arms really far overhead. Okay, so be mindful of that, just out to the side, as long as that's comfortable. And then if you have your arms real close to your body, then you're not really opening up your chest very well either. So just settling in. Tune into the openness of the arms. Notice where you feel it. I'm getting a little bit of even kind of numbness into my hands right now. That's how much tightness I have going on. And that tightness is especially up in my chest and the front of the shoulders, where those nerves that come down from the head and the cervical spine that go out into the arms through an area that we call the brachial plexus that goes through the armpit area. There's a lot of fascia and soft tissue there that can get compressed, especially when we do a lot of work with our arms, and I do a lot of forward things with my arms and hands. And that can get very tight. So as we're opening this, we're making it a little bit tighter. And it's that whole stepping on the garden hose analogy. So we're getting, some mixed signals in the nerves there, and the vascular system is also compressed. But it's mild. And then giving our body an opportunity to adapt to this new position will actually change that tissue and give it more space. Also feeling this between my shoulder blades, which feels really good. So just let yourself settle in. Long, slow inhale and long, slow exhale. Notice what part of your body moves with your breath. We want to pull that down into the belly. As you're listening to the body in this position, notice where you might feel this pull. I just started to feel this going up into my ears. Notice your face. Can you relax your face a little more? Be aware of your eyes, your eyelids. Soften your eyelids. Maybe even think about your eyeballs. We have lots of tiny little muscles in our eyes that help us focus. See if you can relax even your eyeball, like you're letting it sink deep in your head. What about your lips? Can you just completely relax your lips? Have you ever even thought about the muscles inside your lips? This is really fun. I started doing this recently. Just noticing that I was tensing my lips. You ever notice how as we age, our lips get thinner, not as full and plump? I think a lot of times it's the tightness literally in the muscles of the lips that we've got tension there. Just begin to relax your lips as much as you can. Relax your eyebrows. Bring your awareness to your heart center, the center of your chest. Of course, we're thinking about the heart that's beating and pumping blood and oxygen throughout our body. But think also of your emotional heart center. Oftentimes, most times when I'm on the foam roller, I'll begin to feel just emotion surface. And remember, we hold our emotion in our bodies, in our fascia, which goes through every cell. And it's very normal to begin to feel, or especially if we allow our bodies to feel emotion, let it arise and dive into it rather than ignore it. Hi. And so now I'm going to shift my head off to the side. And again, if anytime you need to come off of the roller or anything that we're doing, listen to your body over my voice. But I'm just going to shift my head over to the left here. So it's not a rotation. A rotation, my nose would turn over to the side. We're keeping that nose pointed up to the ceiling. We're just letting the head shift off a little bit. So now that roller is compressing more into my right side of my shoulder blade. The other thing to note is if you're getting a lot of, if this is like too much and you've got a full foam roller, you might need to put a pillow or blankets underneath your arms. That's always okay to do. And this, I'm really feeling this pull up into my neck right now. And as it's letting go in my neck or feeling the tension there, I also feel the tension all the way down to my pelvis on the right side. Feeling this more intensely down my arm now, but it feels so good. That part of my shoulder blade that is pressing into the roller. Oh, I just feel that tightness, but it's a good sensation. Always tuning in. Remember, as you're listening, if it becomes too much, that M, that move, means move out of it or back up a little bit. And even if you were trying to go for a certain amount of time, if you don't, Allie's flip. She likes to flip her tail on you as she's walking around. It's so cute. Just listening to your body, even if it's, less time than you really wanted to be there, we got to stay out of channel 5. We got to get out of our head and into our body and feel. Oh, that feels really good. I just had a shift there that let my head come down a little more. So I'm going to lift my head back up to the center and go over to the other side now. And nose pointing up toward the ceiling. And it's just so interesting how it feels completely different over here on the left side. So remember the right side, I was having a lot of, numbness and tingling into my hand the last couple weeks. And this side, I don't feel it as much into the arm, but I feel it higher up on my upper trap area towards my neck. And relax into it. Oh, I just felt a nice adjustment there in my cervical spine. And when I went the other side, remember I could feel it down into my pelvis. This side, I don't feel it in my pelvis at all. I really believe that the key to success with self-treatment is really expanding your awareness in your body. Every move that you make and every position that you get into with self-treatment, where are you feeling it? What does it feel like? What is the quality of that sensation? How far does it go? What other part of your body is connected on this side versus the other side? Now that just pulled all the way up more into my my cranial bones, less into the neck and shoulder blade that I was feeling on the right side. Nice long deep breath. Just gonna bring the head back to center now. And just kind of quickly before I come out of this position, I'm gonna lengthen my left leg, reach and lengthen for a moment. And then the other side, reach and lengthen in the right. You guys can't see my kitty. She's being really cute right now. And bringing my knees back together. And you know, I had this pillow over here, and oh, it feels so different now lying here than it did when I first got here. And I can feel it though down my back. I'm ready to get off of here, right? So there's the listening. It's like, I've been here enough. It's time to get off. I can feel it in the back of my head. I can feel it down my spine. But this whole area and my shoulder blade and my arm, and there's a little bit of strangeness in my hand, but that's to be expected. And so now I'm going to take this off and remove the roller. You know, something else you can do with a pillow is to put the pillow horizontally. You can also do it vertically like the foam roller, okay? But if we can do it horizontally like this, being here just for a little bit, really opening the chest a little bit. See how I'm getting an arch in my back here? I'm just gonna be here for a couple of movements with my hips. Let the knees go over to the right and then the left, just a couple times. All right, and moving the pillow out of the way. Oh, I have two kitties over here. You guys see my kitties? There they are. There's Fluffy and Owly. They usually join me. Okay, we're gonna take the yoga strap. And I'm gonna place it around the ball of my foot. And here's the trick. You really need to put it around the ball of the foot and not the arch, because if I put it around the arch, it's a totally different position. Now, I used to be so completely tight when I was younger, like I couldn't even pull my toes back. And I see this all the time in my patients. They don't have that dorsiflexion where they can bring the ankle like this. They get stuck at 90 degrees at the ankle, and we really need that extra motion. So we're going to bring this up to the ball of the foot. I like to cinch it up like this, and I like to wrap it around my hand. Now here's the key. Everybody's always like, how do you do that? I put the strap next to my thumb like this, and then make sure that's at the back of the hand. I wrap it around. Now, I've been doing this so much, I know exactly how much I need in my strap length to get it where I want. So you might have to play with this a little bit, but what we want is the arm to be straight. A lot of times I see this, okay? That's not what we want. We don't want to muscle it here. I want to reach up high, wrap the strap around so that my arm is straight, okay? What that's doing is lengthening into the shoulder, and it's kind of giving me an arm pull while I'm getting a leg lengthener here, okay? So you can't really see everything that I want you to see, but hopefully this will work. Okay, so the bottom of my foot is pointing up to the ceiling, and my arm is here. My hand is holding on, and my left leg is extended. Now, if you're here and the knee is bent and you need to be here, it's okay if your leg is way down here, by the way. In fact, I'll just show you what that looks like. If you can't tolerate straightening that other leg, that's okay. You can bring it up here. But let's say it is down. Watch my arm here. See how I can do this? Notice that my elbow is straight. What am I doing? I'm using my shoulder girdle to do this movement, okay? Tune into that because you really want to feel it. Now, the tendency is for everybody to bend their elbow like this. Straighten the elbow and let the shoulder blade go, okay? When I do that, I feel it all the way up into my head and neck, which is really great because I'm getting a gentle pull here. Now I'm going to cinch this up a little higher so that I can get at my end range. And I'm lengthening into this whole area. I'm not forcing it down. See the difference? there are certain times where we do want to do that. We want to have good form, and that good form means bring that shoulder blade back, but not here. I want the strap to give me a nice arm pull, and I want to relax through here as much as I possibly can. Okay? So holding here, and now I'm reaching my left leg away, just like we did the lengthener earlier. And now I'm doing the snow angel and lengthening my arm overhead as I reach the right heel away. Let that pull into my right arm. I'm reaching my left arm. Boy, do I feel this tightness in my left armpit. Wow. I didn't realize that side was that tight. But see, I often don't do the roller before I do the hip strap series. So I'm in a different place now using the roller than I would have been. And from here now, I go out to the side. And I need to move a little bit because I'm going to hit the wall. Out to the side. And again, I'm still letting the arm lengthen here. And it's kind of nice. I'm actually resting my foot on the wall here. I could, if I wanted to, let go of my hand, but it's actually giving me a nice arm pull as I'm pushing my foot into the wall or toward the wall and lengthening the other straight leg that's along the floor, my left leg, opening up that whole side of my body. Oh, that feels so good all through the inner thigh and even into my core. So this is a position that I could stay in right now for quite a while, but I'm not going to right now because I have a bunch of other positions that I need to do too. But I'm going to remember that how this feels really good. Like it's really needed to me right now. So I might go back to it. But for now, I'm going to go from here into a bent knee position. And this is kind of specific. So if you think about bringing the knee into the chest, all right, but you're going to splay the knee out to the side a little bit toward the armpit kind of, and then you're going to lift the foot up. So the shin, we want that shin to be straight up and down. Even if it means you're way up here, okay? We want to splay the knee out to the side. We don't want it pointing down like this because it feels completely different. Just watch yourself from here to here, right? Big difference. So maybe you need to hold the strap and bring your elbow down to the ground like this. Or if you can reach the outside edge of the foot and lengthen this other leg if you can. If it's too much, go ahead and bend the knee because look what you need here. When I straighten this leg out, I need mobility all through the front of the pelvis. Now, for me, this is really key because I've had 2 C-sections. I've got a lot of tightness in my pelvis. That's part of what made me feel that back pain when we started out was the tightness right here. I'm straightening this leg out now. And then I can reach the arm overhead if I want. I can also take this right leg and reach up toward the ceiling, taking the hand with it, and I'm getting a little bit of pull into the front, again, of my shoulder girdle. So now I'm going to take the strap in the left hand. I've still got the strap on the foot this whole time. I'm going to let it come across the body. I'm letting the pelvis come up so you're getting that twist. The lower body's coming up. I need some mobility in my trunk to get here. And I'm keeping my right arm and my right shoulder on the floor. I come away. Now I'm going to turn my head away from where the foot is going, like you're wringing out the washcloth. Now another thing I'll do here is think about this leg that's going over. In fact, you can even think of putting your hand here and push the pelvis away from the ribs. So I'm lengthening away a little bit more. Oh, and I actually feel this in this front of my right shoulder again, like this whole chest area where it's real tight, where I felt like it was higher up to the ceiling when I started. I can feel it really going into there. I can feel it going into the ribs on the right. Oh, it's actually really kind of going into my heart area. this is what I mean when if we can pay attention to the emotional side of things as we're moving, like I literally can feel this tapping into some emotion here. And I can't even give you a name for it, but I'm just gonna feel it here. It's a heaviness. Almost a scariness. Breathing into that, just acknowledging that. And we're kind of rolling over onto our side here already, so we're going to continue to do that all the way over to the side. Now, here's the tricky part. You're going to let the strap roll around on the foot so that your toe is pointed now. This bottom knee stays bent so that you don't feel like you're going to roll over. Take it around your shoulder. I'm not messing with my mic here. And I like to place my hand on the floor for support. Now, looking at the thigh, a lot of times we want to go up like this. We go down like this. I feel it even more in the front of the thigh. If I'm here, I'm kind of cheating a little bit. When I come straight out, I can really feel it. Now, the tendency too is to kind of arch in your back sometimes. So notice that. Try to keep this nice and steady and just go back with the thigh and the knee. I like to put the strap over the shoulder like this, over the upper trap, so that I'm actually getting some compression on that tight area as well. Reaching the knee away from the waist and taking the hand, if you can tolerate it, with your left shoulder, bring it alongside your head. Now you're getting a release here too, or you're taking up the slack of that tissue, I should say. Ah, that whole area in the front of my hip and the front of my right thigh just feels really good to be in this position as I'm lengthening away. A lot of times these positions and the self-treatment techniques that I do, it reminds me, it feels so good when I'm doing it that it's like when you have a really bad itch, and you go to scratch it and it's like, oh, it feels so good. Or if you're really thirsty and you get the perfect temperature of a drink of water and it's just so quenching. I like to think of the self-treatment as very quenching of the tightness in my body. It's just feels so good. And if you can find that for yourself, it really helps you desire to do this more. A lot of times I get the pushback from patients where, oh, I don't really like doing it. And, yeah, I haven't done it. I mean, my desire for you is that you will feel this wonderful sensation that I feel when I do these things so that you'll actually want to do them. And it's like your drive to do it. Okay, so I'm going to take that one off of this foot now. Oops. Can't get it around my awesome toes. There we go. And I'm going to place it on the left foot, but before I bring it up, I'm going to take a moment and feel. What does it feel like now after doing that right side compared to the left? Oh, wow. Very different. It's hard to describe, but this right side is now closer to the floor than the other side was at the beginning. Okay. Oh, it makes me yawn. Let's take the strap into the left hand. Remember, holding it between the thumb and the fingers, clasping it, and then taking the palm away. So letting it wrap around. It might take you a few times to get the right position. And if you need to bend this right knee or straighten it. And notice if one side is tighter than another for you. And it's so interesting to me because I have way more symptoms on my right, and a lot of stuff is tighter on my right, but then certain things are tighter on my left. It's bizarre. Like this feels tighter over here than when I brought the right leg up at first. So remember, you're going to let the strap pull your shoulder blade up. So it's not like you're trying to pull the shoulder blade down actively. You're going to let it go with the strap. Oh, wow, I feel that way up into my neck on the left. Reaching the right heel away and snow angel the right arm overhead or wherever you need to stop. Oh, boy, I feel that pulling right into my heart center. Feels completely different over here. You know, we have this saying, find the symptom, look elsewhere for the cause. And I'm often reminded that I have a lot of symptoms on my right, and I know I have that more tightness from my scarring on the right, but this left side is very tight. So I need to pay more attention to this side too. Where are you feeling this? I'm lengthening my left heel up toward the ceiling and I'm letting my arm go with that. Lengthening the right leg and the right arm, opening up all the corners of my body. Hi, Tommy. Come here. It's so funny. It's like the cats like know I'm doing a Zoom when there's other people tuning in. It's so interesting. Yeah, you do, don't you? You know, this is Tommy. Mm-hmm. And now we're going to take the leg. Oh, you're going to, oh, look at this. Why, thank you. He doesn't normally do this. I'm going to bring the leg out to the side now. And I'm going to bend my right knee. Well, maybe I can't. Maybe I can straighten it out. I'm going to try and balance Tommy on here. Oh, that feels really good having you there. Mm-hmm. Yeah. Could you feel that, what was going on? Could you feel that in my heart? Yeah. Tommy has an interesting story. He was a feral cat and he got very hurt. But I had fed him a few times when it was really cold. And so he came to visit when he was really hurt and he thought, maybe that lady will help me. And I did. Yeah. As I lengthen this right side, though, I really feel that same spot of tightness that was going into my low back before. I'm going to bring that leg into the chest and splay it out to the side. Remember that position with the knee bent, but we're going to get that shin straight up and down. And maybe you need to have the right knee bent. That's okay. I'm going to try to straighten it out. And I'm going to reach up with my left hand. You might need to grab the strap instead. If you are grabbing the strap, try to let enough of the strap come through that you can support your elbow on the floor. If you are grabbing the side of your foot, play around with the foot, pushing your hand up so you're lengthening into the shoulder blade. I'm reaching my arm overhead now. I feel a lot of tightness in the front of my right hip. Notice the sensations you're getting. Should feel good. Again, staying connected, assessing always, and listening deeper. Honoring your body by moving out of the position when it's time. There's that heart center again. I'm just feeling that emotional peace. Uh-oh, I got a couple cats here. Come here, Tommy. Yeah, Tommy and Fluffy here. Okay, now I'm gonna take this strap. I'm gonna do something a little different. And I have a very nice long strap here. I'm gonna take the other end of the strap and kind of do a makeshift loop. You see that? I just made another loop for the other foot. And now I'm gonna grab them both like this, kind of loosen that up so that you could do a happy baby here. This is like move myself down a little bit so you can see I fluff. So you can go like this with the knees bent, or then you can go to the legs straight. And here's what I like about this. I'm gonna wrap the strap around my hand again. And because my arms are always needing work, I'm using the straps to pull. Oh, this feels so good. I'm gonna let the legs kind of pull my arms. Now notice I don't have my elbows bent. My elbows are straight. Getting a good shot of the bottom of my foot there. And it's pulling into my arms and my legs at the same time. And it just feels so good. And maybe this is just like too much. And you're like, what is she doing? And that's okay. Just listen to your body. I'm going to bring this up to the center. Now, I'm not going to stay there for a long time, but even just bringing this to the center, kind of like legs up the wall, right? Letting the legs kind of pull my arms. Oh, and it feels so good. I don't know why time goes so fast when I'm doing this, because I just get myself lost into how good it feels. And I hope that you can appreciate that too. Now I'm going to take the strap into the right hand, and I'm going to let my right leg straight and let my leg go across the body to the right. Left arm is coming out onto the floor. And think of that left shoulder as being glued to the floor so it doesn't come up. You're getting a twist into the body here. Turn your head and look to the left. I'm going to use the wall again and let my foot rest there. Oh, that feels really good. Feels completely different on this side. Getting a pull into the side of my pelvis that feels completely different into my left sit bone than it did on the right. And one of the reasons why I do a really, really good hip strap series at least twice a week, it's best if I do this really 4 times a week. 2 of them, though, need to be longer and really kind of focus into these areas. It's because it keeps my pelvis balanced. It's just kind of a magic thing. And when I do classes and I go around the room and I look at everyone's leg length and I tell them when there's a discrepancy, which is most people, and then we do this series, I go back around the room again, that discrepancy is gone 90% of the people. So it really does something. Let's come around onto your side now. We're going to let that strap twist around as we go completely over onto the right. So you're going to see my backside here, and I'm going to leave it this way so that you can see what it looks like from the back. I bring my leg behind me. I take the strap over the shoulder onto the upper trap, and then this bottom leg is bent. If I have the leg straight, it's just like more wobbly. See, if I bend this knee, it's stable. And now I'm keeping this top leg. The tendency is to want to go like this. That makes it easier. I bring it down parallel and I reach the knee away. My arm is under my head if possible, and I'm reaching the pelvis. You kind of think of reaching the pelvis away from the ribs. That made me want to take a nice deep breath just when I did that. And that feels so good in my sacrum, that area where I was having discomfort, which really is all that scar tissue from my C-sections that pulls into my sacrum all the time. Now, I won't have time here on this Zoom, but later I am going to be lying on the floor with my orange ball under my belly right near my scar area because I really can tell I need that. And then releasing that strap and coming around onto my back again. Let's take the strap off the foot now. There we go. And let's compare. Just lying back down again on your back. Wow, I feel totally different than when I started. I only have a tiny little area of my low back that's arched up off the floor now. My legs feel like they're pretty even. And initially, my left foot felt like it was rolling out more. It actually was. Now it's about the same. Shoulder blades feel different. My right shoulder does not feel like it's way up to the ceiling like it was before. Definitely better. So I'm going to just finish with one little part of legs up the wall. And honestly, I probably will do more of this later. I often do legs up the wall right before I go to sleep. Sometimes I fall asleep in it, but not that I recommend that, but it's just what happens. So when you get to the wall, remember the best way to do it is to start facing like this to the wall. So your shoulder is here. Now, everybody wants to kind of lay down with their head over here, but think of your head. Take your arm out to the side, bring your hand down. That's where you want to get your head. So you get into the fetal position. You just kind of scoot your body toward the wall then. And now you just lay down and roll back over. I hope you guys can see me. Okay, so from here, check in if your legs are bent and you're struggling, or if you can put your hand underneath your butt, then you are too close to the wall. You need to move away. Okay, so just getting here, we're going to do mainly this position. Open your legs a little bit if you need to, and bring your arms out to the side. So kind of like when we were doing the roller. And again, tune into your sacrum, your low back, your butt. Is your butt on the ground? Your butt needs to be on the ground. If it's not, you need to move yourself away from the wall. And notice that, just being in this position with your arms out and supported, we're never in this position for any length of time. And if you were sitting or standing, you're holding your arms out like this would be difficult. Even when you're lying in bed, do you ever just lay here with your arms out wide? No. So this is actually helping you so much. It's taking up the slack with all the tissue three-dimensionally through the biotensegrity of the fascia. As your arms are out to the side like this, you're opening up that space that gets so tight with our arms forward all the time. Now gently reach and lengthen your fingertips away from the center body, just like we were lengthening with the leg lengtheners. And wow, when I do that, I can really feel the tightness in my right arm and shoulder. I feel some in my left, but not like in the right. So I'm just going to actively stay lengthening here, very gentle, just to the barrier, just till I feel that pull. And now I can sense that between my shoulder blades. Long, slow breaths. You really feel this pulling into my neck and head. A lot of times people don't realize that this series, and that we're just doing one position right now, but the whole series really treats the entire body and really gets up into the head. Many years ago when I was having migraine headaches, this was something that I found if I could get in legs up the wall early enough, when I was feeling one of these come on, it would really, really help. But right now I feel this into my neck and the back of my head and even into my eyes. I'm still lengthening my arms away.
I just have a desire with what I'm feeling and the tension in my head to bring my hands to my eyes. And I'm just kind of placing my palm of my hand on my eyebrows and also my cheekbones so that the very center of my palm is over my eye. My eye is not really touched, just on the forehead and the cheeks. Gentle pressure. Feels so good. So most of the time, when I really start getting into my self-treatment, it's hard for me to get away from it. It feels so good that I just want to keep doing it. Usually it's some time constraint or I really need to get to bed, something of that nature. It's honestly never because I don't like what I'm doing anymore, or like in your working out, it's like, oh, you can only do so much because you're tired, right? Like this is so, I don't know, energizing isn't the word, but it's calm. It's like the calm technique. That's why when I first started thinking, okay, how can I help people learn to do what I do, which is so effective? And I started writing down, well, I'm connecting and I'm assessing. And anyway, I realized it spelled calm. And I said, how perfect is that? Because this is really calming. And the busy life that I've like always had and kind of created for myself, it's really important to learn to calm. Stress is responsible for 95% of, it's 90 or 95 now, 90, I think they say, of all illnesses. And learning how to calm from within is just so incredibly valuable. So feel free to stay here and kind of go to the other positions. I am going to wrap it up right now, but I really would like to stay and do more, and I probably will. So I'm going to come back to center here and ask if there's anybody who has any questions and just begin to wrap it up. Wow, I feel a lot better in my whole shoulder and arm here. That's really what I need. I have no numbness in my hand now. And when I first started out, there was a little bit of numbness here, and that's definitely better. Okay, so I'll take a moment if anybody has any questions. Otherwise, I will wrap it up. Thank you for joining me, and I would love to hear your questions and comments. What's helpful, what isn't, anything that you might have to help make this better. And just want to remind you that you can always do something to tap into what you're feeling and help it to feel better. And it's the consistency of a practice like this and really learning what is good for your body that will truly help you, and that you really are creating tomorrow's body today. And let that be a motivator for you to come back to your own self-treatment practice. Thank you so much for joining me.